my name is Avish. I'm a PhD student on Imperial's AI4Health CDT program. So my PhD predominantly looks at multiomics. So multiomics probably sounds like a bit of jargon, but it's basically molecular data and all these different types of molecular data that we have, how we can combine them. A useful way I think to think about it is there's a similar problem in machine learning called multimodal perception. So this is kind of basically how your different senses combine. So your things like how you see, how you smell, how you hear. Imagine you have like a video of a bird's wings flapping, and you also have the audio of that. You want to align those two things together. I'm trying to do the same thing, but on the molecular level, and doing that predominantly to understand a disease. And the disease that I'm looking at is called IPF, Idiopathic pulmonary fibrosis. It's where the lung tissue gets very scarred. It makes it hard to breathe in and out. So the aim is that with this multiomics data, we can understand how that disease develops, and ideally, if we can figure that out earlier, we can shift patients towards treatment if they need that. The thing that attracted me most to the AI for Healthcare program was the dual supervision. So when I was applying, it said that you could have a supervisor from the AI side as well as from the healthcare side. And just because basically on my undergrad, I did my bachelor's thesis in bioinformatics, but my background was in computer science. And I remember on that project feeling as though if I knew a bit of biology, this project would have gone a lot better. And that's what motivated me to do my master's in precision medicine, basically trying to get a better understanding of the applied field that I was working in. And I felt as though the PhD combined both of those things, the PhD program that I ended up on. And that dual supervision was, I guess, the best reflection of that I now have someone who's a specialist in AI, someone who's a specialist in healthcare, where I have a clinician for the disease that I study. And just having their perspectives on both the problem, I feel is the best way that you get to a useful solution for the patients. I really enjoyed the courses that we did in the first year, because basically they were more coursework driven. So the ones that I enjoyed the most were the ones where it was very self-directed in terms of how you could do the coursework. The ethics module in particular, it was AI ethics, mainly because the coursework was very self-directed. So we got to choose an essay from like a long list of, I think, 30 or so titles, but then you could very much personalize it to something that you're more interested in. Then go kind of down whatever rabbit hole you really wanted to, find your niche in it. I picked one that was very related to my project. So the actual, my PhD project title is Multimodal Interpretable Learning for Idiopathic Pulmonary Fibrosis. I was looking at interpretability and whether that's needed for artificial moral agents. So whether interpretability is like another name for understanding a model. Do we need to understand artificial moral agents, so agents that make any kind of moral decision, which is quite relevant to my ideas in healthcare. I took more of a societal focus, so I was looking at artificial moral agents at scale, but that was a super interesting project, and it was my first taste of doing proper research before I kind of started decoding and things like that. And the one useful thing with that module as well was I had a chat with the course lead after, and we're trying to write it up into a paper now. So I think there are a lot of sort of avenues that you can take this initial work that you do if you're still interested in it beyond that point. There are a few other CDT conferences that I went to. So one that was in Cumberland Lodge in Windsor, and we went there, it was with other AI CDT programs in the UK. Kind of a more informal one, mainly graduate students, but it was just good to kind of see the other work that people were doing from similar-ish CDTs. The one after that was the AI4Health CDT program. So there are 3 other main AI4Health CDTs, as in from the same funding board from the UKRI as well in the UK. I think Leeds, Edinburgh, and UCL. And the 4 of us, our programs went to Milton Keynes for a few nights. Everyone presented their work. It was just nice to talk to people who are doing things related to what we're doing, but also a bit more niche in that sense, applied to healthcare as well. For me, that was particularly useful because my project is more of a biomedical, bioinformatics kind of project. The majority of projects on Imperial's course, there's a big diversity of projects, but most of them that I've seen are more on the robotic side, or more like trying to apply machine learning methods to, I guess, clinical data. But because mine was more on the biology side, it was a bit harder to find a few people that had the same interest. But the Edinburgh one is predominantly biomedical, so I just had more people I could bounce ideas off with, and I've stayed in touch with a few of the people since then as well, which is nice. The final conference that I've been to was in America, so I went to Machine Learning for Healthcare. This was one of the things that attracted me most to this program as well, was that you get a fully funded trip to any conference you want to go to, regardless of whether you've published any research there, which is quite helpful. And this conference in America was in North Carolina, basically machine learning people, clinicians, and the interface between them. I'm more on the bioinformatics side. My work hasn't quite touched the clinic yet. Hopefully it will towards the end of my PhD, but not yet. But it was quite useful to see what the doctors thought of all the machine learning stuff, and just to get an idea of the things they're skeptical about and why they're skeptical about those things. It just kind of brings you down to earth a little bit about what's practical for your own work. The CDT offers a research tutorial, which is basically where everyone from one cohort will meet up every week. One person presents a paper that they've been reading, and then we discuss them at the end, ask questions about them. It was quite a useful way to just get to grips with reading research papers, because it's quite a daunting task when you first start out. Just the way that they're structured, it's very different to like reading, fiction, even non-fiction, to be honest, because they're very organized and there's like a set way to read them. But it's good practice to see how other people read them as well, and you can kind of bounce off your feedback together. You kind of learn together. So I picked a research paper that again was related to my PhD program, my PhD project on interpretability. There were some other interesting ideas I picked up of some other papers that we read, like Bayesian optimization, things like that. And that was probably my favorite course. Also because at the end of that, we had to do like a research report, like a 3 to 4 page report of the paper that we'd read. And I just turned that into a blog post that I put onto my website. So just like a useful way, I guess, of kind of getting your name out a little bit as well in terms of the research sphere. So that was helpful. The other thing was that we could also take elective courses. So we have like 4 modules that you have to take, and then you can audit other courses, which means that you follow along with the lectures. You don't necessarily have to take any exams or submit coursework. And I did that for a course called Biomedical Statistics. I always feel like it's a thing that a lot of machine learning, because it's such a diverse field, like you get so many different backgrounds of people who work here, you can kind of lose out on some of the formalisms of where it's based on. And statistics modules are great to kind of get that perspective, not just complementary, sometimes even, orthogonal kind of perspective, like completely different, but it's useful and it assists, I think, with how you think about machine learning problems. Particularly for me on the clinical side, just having that biomedical statistics background of understanding how clinical trials work, the right way of doing things like hierarchical modeling, which have a rich history in biomedical statistics, but maybe aren't as well explored in machine learning. Having that perspective, bringing it over, it's really kind of shaped the work that I've been doing over the past year or so.